You might be able to avoid hip surgery and stop your hip pain just by doing these simple exercises and making small changes to your movement and exercise habits. Let me show you what you should not be doing and what exercises to do instead. Hello, my name is Daniel Lawrence. Welcome to the Physio channel. This is a video for people suffering from hip pain here. It targets a specific condition called hip impingement or Femoroacetabular Impingement. We call it FAI for short. The simple advice and exercises in this video have helped many of my patients reduce hip pain and avoid surgery. So this condition can be caused by the hip joint jamming against itself when you flex your hip. Let's have a look at why. It can be caused by the shape of your ball or by the depth of your socket. This is called a cam deformity, and this is called a pincer deformity. Now, arguably, they're not actually deformities, just variations in bone shape. And this is known because many people can have these variations in bone shape, the cam and the pincer, without actually having any hip pain symptoms. So if you have that cam or pincer shape in your hip, it may have been there for some time, and something that you've recently started doing may be the reason for your hip pain. Therefore, if we can identify what that might be, we can reduce or stop your hip pain and reduce the need for surgery. Let's have a think about what that might be. The first one could actually be this position here, squats, particularly deep squats. Going down into that position flexes the hip to a maximal degree and may cause some aggravation. Let's have a think about some other things that you might be doing which are causing that hip pain that you could stop or modify to make your symptoms improve. Before we move on, it would be useful for you to know the movements which aggravate hip impingement. Let's do a test. Lie on your back. Decide which hip you want to test first. Bring the hip up into flexion and use your arms to flex the hip up, bringing the knee towards the chest. Then bring the knee over towards the opposite hip so that your thigh is being taken across your body. The third part involves holding the lower limb and twisting the leg so that the knee is twisting inwards and the foot is being pulled outwards. This test is called the FADIR test because we have flexion, adduction across the body and internal rotation of the leg. Do that and then pull the knee up so that it's heading towards the opposite shoulder. Now you'll notice when you do this that it is squashing the groin. If you have hip impingement, it's very likely that this FADIR test will cause some pain over the front of the hip. So now you know the movements that cause the hip impingement to be aggravated, and they are excessive flexion, bringing the leg across the body, such as sitting cross-legged, for example, so don't do that, and also internal rotation. Any one of those, or a combination of those, will likely aggravate your hip pain. So have a think about some of the things which you may be doing which could be causing that aggravation. They come in three different categories. Category number one is postures and positions that you sit in for a prolonged period of time, like this one. Or it could be an exercise that you're doing with weight, with load, so some form of weight training exercise, like the squat that I looked at earlier, and we'll be returning back to that again in a moment. And the third one is something that you're doing with repetition. So remember, I was on a bicycle earlier. On a bicycle, if your seat is too low, you'll be repetitively flexing the hips, and that will be causing some aggravation. So increasing the seat height on the bicycle could make a significant difference and allow you to ride the bike without any pain or discomfort. Again, we'll have a closer look at that in a moment. One thing that you may be struggling with is fitting shoes and socks. So here's three things to do when you're fitting your shoes to avoid aggravating your hip. Number one, loosen the laces. Number two, when you flex your hip, turn your hip out to open the hip up and don't have your hip in like so. So hip out, flex the hip, pop the foot in the shoe, and then to avoid having to reach forwards if that aggravates your hip, get something like a shoehorn. Here I've just grabbed a ruler, which is going to suffice. Pop that in and that will allow you to fit your shoe. And then to tie up the laces, make sure you turn the knee out to open up the hip, and you can then tie the laces from there. Okay, next we'll think about chairs, stools, car seats and sofas. If your seat is too low, you will have to naturally flex your hips and that may cause some discomfort. So very simply, try to avoid sitting in low seats. If you have to sit in a low seat and you find yourself in a scenario where you just have to sit on a low stool or step, then don't keep your knees together because that will keep your hips quite closed. Open your knees, widen your stance, open up your hips, and then sit down from there. That's going to be much more comfortable. When you're sitting and resting, the worst position would be to have your legs crossed and leaning forwards. The best position would be to have the aggravated hip out. So the hip is open and you're slightly leaning back. This will keep your hip in a comfortable position. But whenever you can, try to choose higher seats or raise the seat. Remember the example on the bicycle earlier as well. In the car, see if you can adjust the car seat to reduce hip flexion and open up your car seat. As long as you're still in a comfortable and safe driving position, then that may make all the difference. So seats, sofas and stools, avoid the low ones, but if you must sit in the low ones, make sure you keep your hip as open as possible. Okay, here's some exercise advice. When you're doing squats, have a wider stance and just go part way down, halfway down for example, and that will still be a great exercise and a great workout for your lower limbs without worrying about going all the way down and trying to get ass to grass as they call it. That is likely to be irritating your hips. So rather than not squatting at all, just go part way down. It will still give you a great workout, improve the strength of your lower limb muscles, and avoid aggravating your hips. When it comes to lifting activities such as deadlifts, there's a few things you can do, and one of them is to have the bar a little bit higher. The other, of course, is to have your hips open. As you can see, I've got a wider stance here. By taking your shoes off, it will drop you down a little bit, effectively making the bar a little bit closer to you, so that will help. Make sure that your weight plates, you choose the larger ones to help lift the bar up towards you, and if necessary, you can pop something under the weight plates, once again to lift the bar up towards you. So once you're able to drop down to a comfortable position, instead of a classic deadlift where your knees are closer together and you're going to be lifting like so, you'll probably find it more comfortable if you have the wider stance and bring your hands in between your knees like so. So just remember, simple strategies, have a wider stance to open up your hips and don't drop down as far, reduce the range of motion. You'll still have a great workout, have all of the strength and conditioning and fitness benefits, but you won't be aggravating your hip, which ultimately could be something which would stop you doing the exercise. So you can keep training just with some simple activity modifications. So I've mentioned the bicycle seat a couple of times, having the seat at the right height so you don't have any unnecessary hip flexion. But another thing to think about is the style of bike that you're riding. So if you're in a racer on a road bike, you're going to be tucked down into this position, and that causes, as you can see, more hip flexion. Whereas if you're in a more upright position, as you might be on a mountain bike, this is going to involve less hip flexion and is therefore probably going to be more comfortable and preferred by people that have hip pain and hip impingement symptoms. Returning back to cars, let me tell you a funny story because I want to hear your comments on this. I had a patient who had a sports car and it was getting in and out of that sports car that caused them considerable hip pain. They were okay getting in and out of their other vehicles and they could do many other things, but it was the sports car that was particularly troublesome. So they said to me, they feel as if they need to make a decision, sell the sports car or have hip surgery pretty much to be able to get into the sports car. So what would you do if you were in that scenario, if you had to have hip surgery to get into your sports car? Would you sell the sports car or would you have the hip surgery to keep the sports car? Let us know in the comments what you might do in such a ridiculous situation. Let's move on. Here's another top tip for you. If you're experiencing the hip pain at night, place 1 or 2 pillows between your knees when you're lying on your side, as this puts your hip into better alignment and can reduce the hip impingement. It's a simple thing, but from experience, it can make a significant difference to your night's sleep. If I asked you to flex and extend your hip, you probably do something like this. But you can also move your hips without moving your legs. Like this, like this, like this, like this, and of course, like this. The research shows that postural control and core stability exercises can help to reduce hip pain. So try any one of these exercises that I've just shown you 10 times, 3 times a day. This is the pelvic tilt, lying on your back. From this position, place your hands over the side of your hips so you can feel what movement is occurring. And then you want to tighten your tummy and flatten your spine so that the lower part of your back presses down into the ground or the exercise mat. So you flatten the spine, and at the same time you can see the pelvis is tilting up, tilting this way. If I exaggerate that movement there, you'll see that we achieve this pelvic tilt. Okay, so a small movement or a larger movement is all about control. 10 times, 3 times a day in order to get the control through that core area. This can also be done in the quadruped position. So we're up here, nice and stable, or of course on the floor, on an exercise mat is often preferred. And then you're going to arch your back, stick your bum out, and then round your back and tuck your bum in. Arch. Okay, so curve the back and arch the back. Curve the back and arch. In the seated position, place your hands over your pelvis so you can feel the movement occurring, and then sit up straight, sticking your bottom out and arching your back, and then tuck your bum under and let your spine curve. 10 repetitions, and you can do any one of these exercises or mix and match them for variety. We also did that in the standing position. Slight bend of the knees, tilt and tilt. Flex and extend. That pelvic tilt exercise, whether you're lying on your back, kneeling, seated or standing, is an excellent way to get started to work on your postural control and core stability to help reduce your hip pain. So that will count as just the first exercise. Remember, I'm going to show you 3 exercises, so 2 more. The next one, lying on your back. Remember the pelvic tilt again. So tilt the pelvis, except this time tense up your bum muscles and push your pelvis up towards the ceiling so that your thighs come into alignment with your spine. And many of you will know this exercise as the bridge, because you're making a human bridge. And back down again. Make sure you keep your breathing steady. There's no need to hold your breath when you do the exercise. Hold it for a few seconds and back down. I would recommend starting with sets of 10 repetitions and doing that 2 to 3 times during the day. You could do it all in one sitting where you do 10, rest for 1 minute, and then do another 10, rest for a minute and do another 10. Or you could space them out throughout the day. Now, if you've got some exercise equipment at home, I'd recommend getting a small resistance band. If you don't have one of those, you could probably use a belt. So I'm going to go ahead and pop this band around my knees, and it's then going to give me a bit of resistance as I push out against the band. That outward movement we call abduction. So now there's 3 components. Tilt the pelvis, lift into the bridge, and push out against the resistance. Hold for a few seconds, bring the knees back together, lower the bridge and relax the pelvis. Tilt the pelvis by flattening the spine and tilting the pelvis towards you. Lift into the bridge, push out against the band, hold for a few seconds, bring the band back in, lower the bridge, relax the pelvis. One more time. Tilt the pelvis, lift into the bridge, push out against the band. Bring the knees back together, lower the bridge and relax the pelvis. Give us a thumbs up if you like this exercise and let us know how you get on in the comments. This next exercise involves a little bit more coordination and stability. So kneeling in all fours with your knees apart and hands apart so you feel nice and stable. You're going to do 2 movements. Movement number 1, choosing which leg you're going to exercise first. Take the leg out to the side and back in. Okay, so that's hip abduction, and that's exercise number 1. You could perform 10 repetitions of that. The second part of this exercise is to extend your leg back so that you're tensing up your glutes and putting your leg out in a nice straight position. You could do 10 repetitions of that one, or you could do the movements combined, like so. Take the leg out and extend the leg back, and then bring it back in again. Out to the side, extend out behind you, and back in. While you're doing the exercise, you've got to stay nice and stable. And as you move the leg, you want to avoid twisting your body so that your core is working hard to keep you nice and stable. Don't forget to have a go at doing the other side as well. So these exercises should not cause any hip pain. If they do, then stop doing that particular exercise and try and continue with the other exercises which hopefully aren't causing you any pain. As always, I advise you get some professional one-to-one assessment if you're experiencing any pain. If you're finding this video and my other hip videos helpful, then you may like to know that I have an online course which focuses on the assessment and management of hip impingement. This hurts and doesn't really do anything. That's because this is your iliotibial band, your ITB. And it's not a muscle. So rolling it or massaging it vigorously tends to just cause unnecessary pain. In this video, I'll show you some better things that you can do to reduce any pain or tension that you may be getting around the hip and over the lateral leg. It will involve a roller and also a small massage ball. The common causes of pain around the hip are showing on the screen here. Now, if you have hip pain, it's common to have muscle tension around the hip and also the lower back. So in this video, I'm going to show you some routines that you can do to reduce the tension here and the tension back here. And let us know in the comments which one works best for you. The first self-massage technique is called the ball on the wall. So you need a small and firm ball. I've got a massage ball here. It's about the size of a tennis ball, but just a little bit firmer. A lacrosse ball is also a common one to use, or maybe one of those balls that you can put in the tumble dryer, which stop the clothes from sticking together. Anyway, a small, firm ball. Then you're going to take that and place it into the side of your glutes. So you're going to need to come closer so I can show you exactly where to put it and how to do the technique. So to perform the glute massage with the ball, stand side onto the wall at a 45-degree angle, and then take the ball and place it against the wall so that it's pressing into the side of your buttock muscles, to the side of your glutes. Slightly bend your knees before you start the technique. I'll move my arm out of the way so you can see. And then with the knees slightly bent, you've got the ability to perform the self-massage by moving up and down. You can also twist your body as well, which will move the ball around through the glutes, working on that soft tissue. You're looking for any tender points. If you find a tender point, pause a bit longer on that point there and maybe slowly move up and down or side to side to massage through and try and reduce the sensitivity. Just a little tip for you, when you're doing the self-massage with the ball, if you feel any tingling or pain down your leg, that would be very unusual, but it might indicate that you're irritating your sciatic nerve. So if that does occur, simply stop and don't do that exercise again and get some one-to-one assessment from a professional. Let's move on to the next routine. Next, I'm going to show you how you can use a foam roller to massage your glutes. So place the roller under the hip like so, and then rotate your body. I'm twisting slightly towards you so that the pressure is going on the side of the hip and therefore through the glutes. From there, I'm going to gently roll forwards and I can feel that going over the glutes there towards my lower back. If I move at a nice slow pace, it's much more therapeutic than if I try and roll too quickly. I'm taking weight through my arm and my legs. If I want to make the technique a bit more intense, what I can do is cross this leg over like so, and then continue to roll. For variation, I can try rolling a bit more towards you to see if I can target some slightly different muscle fibers. Or I can roll back the other way to get a bit more variety into the movement. So from the hip, we can progress to the lower back. For that one, we want to centralize ourselves on the roller. So we're simply sitting on it here. Feet out in front of us and arms go behind. Then we want to let the roller go over the back of our pelvis and onto the lower back. But there's one thing that you must do when you do this exercise, and that is to tighten up your tummy muscles and curve forwards so you've got a nice bit of flexion through your spine. You don't want to be extended, otherwise the roller is just going to force your lumbar spine into extension, which won't feel very comfortable and ultimately won't be very helpful. So flex forwards, flex that lumbar spine, tighten up your tummy and curve forwards. Then roll off the roller and let it roll onto your lower back. Whilst we're down here, let me show you this one for pain in the front of the hip. So have a feel around the front of your hip and see if you can find any tender areas which feel like they are muscular. If they are, it can be helpful to apply some sustained pressure, which you could just do with your thumb, but it can be easier if you lie on one of the massage balls. So when you found that tender point, place the ball at that point, and whilst you're lying on a firm surface, position the ball into the right place and then just sustain that pressure. After a while, if it starts to feel less sensitive, then try moving the ball a little bit by moving your body up or down or side to side. Sometimes little movements like this can just impart a light massage into the area and really help to alleviate the pain and tension. Some of these techniques you can do in the gym. Naturally, some of them you may want to do in the privacy of your own home, but hopefully you'll get a chance to give them a try and they help to reduce the pain and tension around your hip. Let me show you what else you can do. Okay, so we're coming back to this movement again. If you insist on having a go at foam squashing your ITB, or you want to try a routine using the roller over the lateral leg, then let me show you what you can do. So rather than rolling directly over the side of the leg, quite simply roll your body forwards so that the pressure starts to go through the outside of your quadricep, your lateral thigh muscle. So roll forwards like so, moving that foot forwards, and then from there, roll, taking weight through your leg and your arm, not all through the leg on the roller, and that will be much more comfortable than rolling directly over the side of the leg. Perform that for about 30 seconds. Then go the other way. Roll back so that the pressure is going through the lateral hamstring. And then from there, roll forward and back. Once again, much more comfortable than directly rolling over the lateral side of your leg. Slowly up and down for up to 30 seconds, or less if that's enough. After that, you can go onto your front, and we're going to put the pressure through the anterior hip like we did with the ball. So I've just turned around so you can see that a bit easier on the camera. So place the roller there onto the lateral hip, and then rotating the body as required to find that tender point, and then from there rolling up and down slowly for up to 30 seconds. Continuing with this theme, we then worked on the glutes, so you may wish to return back to that and make that part of this routine. From there, you can easily flow onto the lower back. And if it feels good, maybe finishing off with a double hamstring massage. This is called the C sign. When you press into the front of the hip over the painful spot, it actually offers some temporary relief whilst you're pressing. So pain at this point and temporary relief when you press it is the first test, known as the C sign, because of the shape of your hand whilst you're pressing over that point. Let me show you two more tests that can be used to determine whether you have femoroacetabular impingement, otherwise known as hip impingement, or FAI for short. Test number 2. Lie on your back, take the hip that you want to test, and flex the hip by bringing the knee up over the chest. Then bring your knee over towards your opposite hip or towards your opposite shoulder, and then grab your lower leg so you can add in inward rotation through the thigh. So we have flexion across the body into adduction and pulling the lower leg out to internally rotate the leg. When you do that, it closes over the inner groin, it squashes that inner groin. So if you experience groin pain when you're doing this test, that would be a positive test. The name of this test is the FADIR test, and you can see what that stands for on the screen here. It basically explains the movement that you need to do to perform the test. This third test is called the Drehmanns sign. This is usually done by a clinician, but you can try doing it for yourself. Use a towel or a strap to wrap around behind your knee. Then use your arms to pull your hip up into flexion so your knee comes up towards your chest. Make sure your leg stays relaxed and you use your arms to pull the leg. A positive Drehmanns sign is when the knee goes out to the side when the hip is pulled into flexion. A negative Drehmanns sign, or a normal hip movement, would be when the hip flexes and the knee comes straight up towards the chest. So this is a positive Drehmanns sign, and this is a normal or negative Drehmanns sign. The Drehmanns sign is usually used to assess for a slipped hip, but it can also be used to help assess for femoroacetabular impingement as well. So hip impingement is usually diagnosed by identifying where the pain is, looking at the results of the clinical tests, the ones that we've just gone through in this video, and also looking for shape changes in the joint on X-ray. Now, if you'd like to learn more about femoroacetabular impingement, so an online course, the link of which is above and also in the description below. Thanks for watching. I hope you found these tests helpful, and we'll see you in the next video.